dental landscape. So what I'd like to do, Sanket, is if people have questions about about the slides as we go along, we have time to answer those questions. I always, the whole thing with lecturing at the webinar, I always feel disconnected from my people. So
no, we understand that.
Yeah, if people have questions about this case, let's talk about it now. We'll be showing we'll be showing this black triangle case in just a little bit. So does anybody have any questions that we need to answer before we move forward, Sanket?
Let me check.
Is everybody able to switch on their microphones? I see a lot of people have not the microphones are not on. So I'm not sure, is everybody able to speak?
The panelists just have to hit their unmute on the microphone if they want to ask a question. How many panelists do we have?
I think around 16.
Yeah, yes, we are able to hear you.
Okay.
So you can just ask any questions. If you have any questions, you can just ask Dr. Clark.
Sir, right now I'm just watching your beautiful cases. As you progress further, I'll definitely pop up some questions.
Beautiful. All right. Since I cannot see the questions, I'll be relying on you and feel free to interrupt as appropriate. Okay.
Definitely, sir.
One of the things that I think is the most interesting when you look at this is the beautiful radiographic appearance of the Bioclear method. It looks very different than anything we've ever seen before. It's as if the composite and the tooth are one entity, one person. So what is Bioclear? Well, Bioclear started as these beautiful matrices, and then as I began to use the matrices, I realized that I could not use them in the old way, and that I would need to develop the Bioclear method. So some people are just using the matrix, and that's great, but they're really doing sort of bonding and layering and not injection molding with Bioclear. And so there are a lot of different ways to use the matrix. I really don't have a lot of interest in talking about doing bonding with Bioclear matrix. I just want to talk about the Bioclear method. To me, that is the exciting thing. So I'm going to show you a case. This is just, and we're going to be doing the peg lateral here in just a little bit. So this is an article that I wrote called Double Trouble. I'm kind of having fun here. Twins with peg laterals. So this is an article that I did for Dentistry Today. The video, there's a clinical video of injection overmolding their teeth on the Dentistry Today website. So I've got a pair of identical twins. These girls are 13 years old. And so these are the preoperative photographs. And I'll tell you the story about the twins. So in the United States, we have different specialties that are very limited. The orthodontists typically only do orthodontics. The endodontist only does endodontics. I know I met a lot of endodontists in India that actually do aesthetic dentistry. So the India, I think people tend to have are more well-rounded, more balanced. They do lots of different things. Yes.
So, Dr. Clark, in India, we have our degree together with the endodontics. We have endodontics and conservative dentistry. So the restorative part is covered with the endodontics. We do not have a separate restorative dentistry as a subject. So right. We have a prosthodontics and we have a conservative dentistry.
Yeah, and so in the United States, it's very rare for a specialist to do anything other than the specialty, for example. So the girls, these twins, had their orthodontics done by an orthodontist who didn't know anything about Bioclear. And this is quite a while ago, didn't know anything about me. And so the twins ended up coming to me, and the orthodontist said to me, Dr. Clark, I want you to do some bonding on the peg laterals. And the thought process is that, that bonding is kind of temporary, and it's just a couple $100s for a tooth, and the expectations are different. And I told the orthodontist that I wasn't going to do bonding, that I was going to do the Bioclear method, and that he was very intrigued. He was interested. And so I told the orthodontist that I would explain after I finished the treatment. And so before we talk about the treatment that was done for the twins, I want everyone to look at the twin on the left, and I want you to notice what she's doing with her tongue. What do you think the twin on the left is doing with her tongue? So I want to ask everybody that's watching, what do you think the twin on the left is doing? Why is her tongue behind her teeth? So I'll wait for the answer.
I know the answer, Dr. Clark.
Well, you can't tell the answer.
So she's just hiding the. Anybody else, please go ahead.
Interesting.
She's just hiding all the negative spaces. So, you know, the smile looks better.
Yes. And so a lot of people, a lot of dentists, when they look at this, they think that she has a tongue thrust problem because she has an airway problem. But in reality, the twin is hiding her teeth, the harsh negative space. So it's all about absolute essence, and the contrast between white and black is very, very harsh compared to the contrast between white and pink. So sometimes these kids, they figure out that if they put their tongue behind their teeth, it doesn't look as bad. So here she is. I told her to pull her tongue back, and you can see that she has undersized lateral incisors. And remember, the orthodontist asked me to do some bonding. And I looked at the case and I said, well, let me ask everyone that's watching, can I do a good job for these identical twins if I do just bonding on the laterals? Will that look good if I just do the lateral incisors? Is that going to satisfy the case aesthetically? And the mother told me that she wanted me to do the most conservative thing. She said, you know, she loves her girls and she does not want to compromise. On the other hand, you know, she's doesn't want to spend any more money than she has to, and she doesn't want to make the case any more complicated. And so she said to me, you know, if these were your girls, what would be the least amount of treatment, but without any compromise? So what I want to ask all the people watching, how many teeth would you treat? And let's say that you're an expert in Bioclear and in additive dentistry, and you have full confidence that these teeth can last for 20 years, at least 10 years, with injection overmolding. Let me ask the people, how many teeth you're going to do? So let's get some comments from the attendees about what a proper treatment plan might be for these girls. And remember, they're 13 years old. So let's wait to see how many teeth that people want to do. Is it just the laterals? Could it be the laterals and the central? Could it be the laterals?
I think only lateral would also do.
What's that?
Only both the laterals also you can treat. You need not probably applying the principles of conservative dentistry and do as minimum as possible. Treat only both the laterals.
Okay, so that's one idea. Okay, let's see some other ideas.
Yeah. Or veneers.
I think I would treat with the lateral and the canine because the space looks really wide if we just do the lateral. Maybe all six.
Okay, so Disha is thinking 4, maybe 6. The first doctor said just the laterals to be the most conservative. But remember, the mom says, I want to have an aesthetically ideal case. So let's see what else some of the other people say.
The distal of centrals and both mesial and distals of laterals.
Okay, but I want you to look at this picture right here. Can everyone see this? The distal of this peg lateral, how are you going to close that space aesthetically with doing just the lateral? Are you sure you don't want to add the canine? Look at that space. It's a big space. That's going to look pretty weird, I think. So you could do this case a lot of ways, but I'll go ahead and tell you what I did. Was I got started on the case. I looked at the space, especially here. I said, nope, we're going to do all 6 of the anterior teeth, because not only did the patients want to have the space closed, they did not like the gray incisal edges. I know that for many years, people thought that doing translucency and layering for translucency was exciting, but most patients really don't like the gray tooth. They want, I mean, why do people bleach their teeth? Because they want them to be more opaque and they want them to be bright. So these are the matrices that I used in the case. I used the, with the classic Bioclear system, these are the green or diastema closure version of the matrices. In her case, I used DC202s, DC201s, and DC203s. We'll talk about those matrices here in a minute. This is the DC202. I did trim them matrix. I'll talk about that in just a bit. Here we are with the Bioclear aquarium. We like to call this the aquarium. Once we wrap the tooth with the Bioclear matrices and stabilize them, it allows for injection of heated composites, both we put in adhesive as a surfactant, and then flowable, and then paste. And then when we surround the tooth with the matrices, it allows it to basically crown the tooth. The polymerization shrinkage is favorable, actually. We like polymerization shrinkage in the Bioclear method in many applications because it actually puts the tooth into compression. We shrink wrap the tooth, as we say. And there it is. There's the acid etch. We've been able to reflect the soft tissue apically with a well punched rubber dam. I've already completed the central incisors. Here is the preoperative view of that from the lateral view. There are the what we call the hip. We're going to take heated flowable composite and put a 1 to 2 millimeter hip in there. We'll hold the matrices and stabilize them. We'll light cure that, and then we'll do what's called delayed wedging, which we're going to show you in a minute. We'll put the diamond wedges in on the mesial and distal. That pushes the teeth apart, and then we'll injection mold the rest. And there's the postoperative view. So that is a lateral view where I did the canines, the centrals, and the laterals, all 6 teeth. So I did 6 teeth on both of the twins. And there we are, pre-op and post-op. That is the Bioclear method. It's not bonding. There are no margins here. The infinity edge does not stain. But when we injection mold, we injection over mold usually most or all of the tooth, and then we have to teach the doctors how to quickly and safely sculpt the extra composite away that's in the injection zone, and then maintain the Bioclear zone, which is an everyday job for Bioclear dentists. It's new to a lot of people watching today, but if you do Bioclear every day like I do, it's just like getting up in the morning and having a cup of tea. It's just what we do. So here's the preoperative, and there is the postoperative. So I did all 6 teeth. And so this is kind of fun. The twin on the left had the Bioclear treatment done on Tuesday. And then the twin on the right, this is Wednesday, she's about to get in the chair and have her 6 teeth done. So I thought it was kind of fun to take a look when I had one twin all done and the other was ready to go. I think the twin on the left was born first. So mom said that she got to have her Bioclear done first. And isn't this cute? Isn't this fun? Isn't this why we went to dental school, to touch the lives of these wonderful young people? And these little girls, they're 13 years old. They have another 90 years to live. And so I satisfied the objectives of the Bioclear method. This is a gift. I just keep cycling through and through. So here we are preoperative. Here we are postoperative. And so what a life changer. What a change. So the 3 goals of the Bioclear method are: number 1, preserve. Preserve and respect the natural tooth volume and the natural biomechanics. I didn't cut the teeth at all. All we did was disclose and blast. to remove biofilm. The next thing is to replace the missing or the diseased or the broken tooth structure. And the third goal of the Bioclear method is to thicken and opacify a thin, dark tooth. People don't like dark teeth. And so the Bioclear look is something that patients love. It's smooth, it feels more natural to them. The pulp is not affected. These teeth have zero sensitivity. It is something that patients are absolutely in love with. Now, not every dentist loves Bioclear because dentists have habits and we have biases and we think we have to put 10 layers in the tooth and we think we have to cut the tooth, and all of these things are in our heads. And so this is a 3-year follow-up of the twins, and here is a 7-year follow-up. So the girls are now 20 years old, and these are the twins. And you know what's funny is that the twin on the left, I believe, won an award in her high school. And she won the best smile. In America, they have these crazy things. They have elections in high schools. And the girl on the left won the best smile in her high school. And if she won the best smile in her high school, I'm happy. I'm content. I don't care. You know, if when I go to some of these fancy academies of aesthetic dentistry, they might say, oh, something negative about the case. I don't care. These girls love their smiles. I didn't cut the teeth at all. Mother is so happy, and she won the best smile in her entire high school. So you know what? I would rather win that award than an award from some academy of aesthetic dentistry with a bunch of old dentists. So part of the Bioclear culture is that we put our patients first. The patient is the boss. It is a patient-centered outcome, not a doctor-centered outcome. And so why don't we stop for just a minute, and I can back these slides up, and you can take a look or ask questions about the case. We used Filtech Supreme Ultra. We used the white shade. They wanted bright teeth. I usually use B1, but they wanted white. So it's a little bit brighter than I sometimes do. So these teeth feel smooth and healthy and strong. And so I'm curious to see what everyone thinks of the aesthetic of the case, or if people have questions about matrix selection or anything else about the case. We're going to show you how to do this in just a minute. So let's open this up for questions real quickly about the twins.
So Dr. Clark, at age of 13, I would not want to do the veneers. So if not Bioclear, what option do we have? Direct bonding?
Yeah, there are no other options that I would be comfortable with, because bonding is, I don't do it. I'm tired of it. It's embarrassing. It breaks. I haven't done any bonding in 15 years, and it's not profitable. We're trying to do our patient a favor, but a lot of the times we don't do them a favor. If you were to put porcelain veneers on these teeth at age 13, what's that going to do to the opposing teeth over the next 90 years? Porcelain is, you know, at least 7 times harder than enamel. It's going to wear out the lowers. And what happens when her gums move? The soft tissue, these teeth are still erupting. If you have a margin, it's going to show. With the Bioclear method, there are no margins. Let me back up and take a look here. When you see this with the infinity edge, if her gums recede, the margin is so blended with the Bioclear method with the infinity edge that it's okay for the gums to recede, which they are going to move as these teeth continue to erupt until the girls are in their mid-20s. So yeah, I think Disha, that's great. What other alternatives do we have? And these girls want to start smiling today. They want to be confident today. They want to have their picture taken. They want to take selfies today, not tomorrow, not next year, right now. And that affords patients what they want. They want it beautiful and strong and healthy, and they want it done by 5 o'clock. Well, we can do that now.
Yeah, I agree.
Let's see what,
Disha,
Do we have any comments from some of the doctors watching?
Yes, I do have a question from one of the doctors, Dr. Ahmed. So he is asking, when we close the black triangles, there is a difference in contact and contour. Won't that be deleterious effect on interdental gingiva?
One of the interesting things is people are always asking questions about the periodontal health of a case. When the Bioclear method is done appropriately, the periodontist, and there are many, many periodontists who are working with us with the Bioclear method, their observation has been that the soft tissue health actually improves because we have less food impaction, less area for bacteria to accumulate. If you look at the studies, a patient with the black triangle generally has less periodontal health than a patient with a full papilla. And that's because there's all this space for food impaction and just more bacterial accumulation. And so if the Bioclear procedure is done appropriately, we see we have an improvement in the periodontal health, or at least the same. One of the things that we've seen with periodontal patients and orthodontic patients, because the contact is so broad, we see less mobility. So for example, I have Bioclear in my teeth, and I had black triangles with point contacts. My teeth have less food impaction and less pulpal pain, because food impaction can lead to pulpal pain and mobility. So my teeth actually have decreased mobility. So I know that it may seem counterintuitive, but we have to create broad contacts if we're going to have a stable and healthy periodontium. If we have a point contact and loose teeth, they are less healthy. Now, it would be great if the patient never got a black triangle, right? But once it happens, we have to do something, and that something improves the quality of life for that patient. So that's a question that we run into, I think, early on with Bioclear. I think once people start doing Bioclear, they realize, and they can do their own research, that we see a lot of great health after Bioclear. Remember, the margins around Bioclear are so incredibly precise that the soft tissue responds beautifully. But that's a good question, and I get that question. I think for people that they're new to Bioclear, that's a question that comes up all the time. So I appreciate that question. Disha, do we have any other questions?
We have a question.
Let me
from
back up here just a little bit, and I want to add. So the question is, how does the soft tissue look before, pre and post-operatively with this young lady? I want you to look at the color, the texture of the soft tissue. It's a very reasonable texture and color for the periodontium in this case. So if you had an overhang, if you have a crown margin, if you packed cord, if you cut the tooth, it's not going to look like this. But we see this soft tissue response with Bioclear, and that's why so many periodontists are very excited. And yes, we would love to see some studies done. We would love to see some studies done with clinical outcomes with careful Bioclear treatment for black triangles and peg laterals. Go ahead, Disha.
So Dr. Rohit has a question. He asked, do all Bioclear matrices need customization? Can you explain a little about that?
The original Bioclear needs customization because they are basically a matrix that can do everything. And then once we built the original Bioclear series, we're developing other matrices that need very little trimming. So we'll talk a little bit about the black triangle matrices. The black triangle matrices do not need trimming. I almost never trim a black triangle matrix. The 360 veneer matrix needs some trimming, but less trimming than original Bioclear. So there is some matrix trimming and modification that's just part of being a master of Bioclear. We would have to have 500 matrices, Disha, if we 500 different types if we were never wanted to trim the matrix. But trimming the matrix is fun. It makes you feel like a master. sort of unlocks the potential of Bioclear. Because remember, every patient's a little bit different. The attachment is different. Some people have a large papilla. Some people have a very blunted papilla. Some people have a high zenith. Some people have no zenith. So there are so many varieties in the mouth that the true masters of Bioclear are never afraid to modify the matrix. But that's a great question. I love these questions. It means that everybody's really thinking and everyone is really engaged, which is great. Okay, Disha, other questions?
Yes, I have one more from Dr. Sanket. So he says, how to select appropriate metrics for these kind of cases?
Ah, okay. Well,
meaning the size.
Yep. So that is why we have Bioclear classes. And so there is so much to learn. It's not that Bioclear is complicated. It's just that there's so many things that we can do. So we can, there are other webinars that we can send to you, or other information about matrix selection. And I don't have a video camera on my face today, so I can't explain the matrix selection. Maybe if we, at our next webinar, I'll talk a little bit about anterior matrix selection, since the camera isn't working today. But that is like I said, Bioclear is a journey, and we are taking the first step today, and we have 100 more steps to take, because there's so many things that we can do. You know, Disha, this is amazing. I did a case yesterday, the distal of a canine. I had to invent a way to create a tight contact that I'd never done before. And I'm thinking, wow, I invented this 20 years ago, and I'm still getting better 20 years later. Isn't that exciting?
I think it's going to be a really long journey.
Yeah.
I mean, I have to keep coming back to learn from you.
Yeah, there's so many things that we can do. I'm amazed. I invented this, and I am still learning. I'm actually getting better every day for 20 years. So everybody has to be patient. All right. So I want to tell you a little bit about my journey. This is me. This is 25 years ago. I'm just out of dental school, and I'm using flat mylar because that's all that we had. And I had a new camera, so I took pictures of this composite case. So we're going to tell a little story. This is 25
Dr.
years.
Clark?
Yes?
Dr. Clark, just 1 minute. There's a lot of disturbance at the background.
So we have some
in
disturbance?
the FB. So guys, if you can just mute yourselves, and if you have a question, you can just unmute.
So what we need everyone to do is to mute your microphone unless you have a question, because you know, we have barking dogs and cyclones and cars honking their horns. So everybody turn your microphone off unless you're ready to ask a question. Is that what you're saying, Disha?
Yes, Dr. Clark.
Okay.
Yeah.
All right, perfect. All right, so let me tell my story. Is that this was 20 years ago, I think. I'm just out of dental school. I think 25 years ago. I have my new camera, and I've got my flat mylar, and this guy came in. He had he had an old filling, took it out, and this was the standard of care. I put a wooden wedge in there because that's what we had, and I had a really nice margin on this. I was so proud of my margin right here. So, you know, it's funny. I put the composite in the tooth, and I'm going to be doing some smoothing in a minute. And I don't have that slide, but still remember doing this case, and I handed the patient some floss. Now, if you can see my little arrow right here, but as I finished this, took the rubber dam off and gave him some floss. And I said, I want you to feel the margin here. Your margin is so amazing, because I love margins. I still do. And the guy was so upset. He goes, look at this. It looks terrible. It's got this stupid black triangle. And I said, what is a black triangle? This is 20 years ago. I said, what is a black triangle? And he goes, this. He pointed his finger. He says, it's this huge space. It wasn't there before. He says, fix it. This is horrible. And I said, well, margins are the only thing that matters. And this guy says, no, This is ugly, make it go away. And I said, well, I don't have a curved matrix, and I'm supposed to use a wooden wedge. And he said 3 words I'll never forget. I don't care. Make it go away. So I swore to myself that day, 25 years ago, Disha, that I would find a solution for this poor old guy. So when we take a look at the legacy of old concepts, old materials, not thinking about a patient-centered outcome, I thought it was great, and the patient thought it was terrible. Isn't that funny? Well, it's not that funny. And so then I invented the Bioclear matrix. So here's a case. These are A103 matrices, and I'm going to be treating some black triangles, and I'm doing 2 at a time, which is what I used to do back then. You can see that the matrix is seated fully. It goes all the way down to the bottom of the sulcus. I looked under my microscope. I do all my dentistry with the microscope. I looked under the microscope and I said, wow, look at that. These margins are going to be amazing, and I'm not going to have a black triangle, and I know it's going to be healthy. I need to come up with a method. I need to figure out how to get the composite in there to this infinity edge. And that was the day that the Bioclear method started. That was a long time ago. And so we need to move beyond flat mylar, and we need to move beyond cutting the teeth. We need to move beyond a doctor-centered outcome to a patient-centered outcome, and that is the journey of the Bioclear method. And so this is bonding. This is the B word, right? This is what bonding, unfortunately, it looks like when you take cold composite and you put it in by hand with flat mylar. That's what it looks like to treat a black triangle. Now on the bottom, you can see a very different look to treatment of black triangles with the Bioclear method. So I did not do the top teeth. I did the bottom teeth. So let me ask the people that are watching the webinar, what does this x-ray look like? What kind of flower do these lower incisors look like? So let's open up the microphone. Because when I first did these restorations, the x-rays looked weird, right? They looked foreign to my eyes. So Disha, do we have any comments? What kind of flower do these bottom teeth look like?
Not yet.
What's that? So we've got a bit of a wait with Facebook, so we'll wait for people to comment. What kind of flower? A flower comes to mind when I first saw these x-rays of all these.
For me, it looks like a tulip.
Well, that is exactly right. To me, it looks like a tulip. Yep. So let's go over the basics of the Bioclear method. Number one, we have to disclose and remove biofilm because we're no longer cutting the tooth. It's critical that we use disclosing solution to help us to see the biofilm. Phosphoric acid does not remove biofilm. And then the next thing is modern cavity preparations. This is the Clark Class 2, which we'd love to be able to help teach in the schools in India. It's the opposite of a GV Black prep. It's the opposite of a slot preparation. And that's a conversation that we're going to have at the next webinar when we talk about the Clark Class 2. The next thing is the Bioclear matrices. These are not sectional matrices. These are anatomic tooth forms, and they are very, they have a lot of features that are very different than you could ever do with a metal matrix. So it is quite an engineering feat to be able to take these matrices, or for example, to put one on the mesial and one on the distal and essentially create a crown without having to do a diagnostic wax up or any stents or layering. And then the next thing is injection molding of composite. We like to use Filtech materials. The Filtech is the most tested composite with heating. And so we have a series of studies, and we can forward those to everyone so they can read about the research that's been done with the heating, with injection molding, how we get less voids, how we're able to mitigate polymerization shrinkage stress. But it's all about the delivery of the composite, injection molded, heated with flowable and paste together to create these beautiful monolithic forms. And then the final thing is the Rockstar polish. That is something that takes a little bit of training, and the matrix cannot cover the whole tooth. So we have areas that we have to cut back and create a beautiful smooth finish because patients love the way these feel. Patients care more about the smoothness of the restoration than the aesthetics over time. They really care about the smoothness. It's something that they can touch every day with their tongue. So the Rockstar polish is so key for a good patient-centered outcome, for stain resistance, and for strength. So I'm going to tell this story, and then we're going to get started on the peg lateral. So it's important that everyone on Facebook get ready to answer these questions. So Disha, I don't want you to answer any more questions. I want to make sure that I want to make sure you let your other doctors answer these questions, okay? So this is a patient who was self-referred. This is a patient who came to my office. She is the wife of an orthodontist, okay? Her husband is an orthodontist, and he did orthodontics on her. And this is not uncommon in the United States. She has had orthodontics done 3 times. She has been through orthodontics 3 times. And so here is her story. She had the orthodontics done, and then she had an undersized or peg lateral incisor on the 2-2, the left lateral incisor, and she sent this patient, or excuse me, the orthodontist sent the patient to the dentist in his town and said, will you please do some bonding on the lateral incisor? So it's kind of like the story of the twins, where the orthodontist wanted me to do bonding. And I said, no, I am not going to do bonding. I'm going to do Bioclear. So I had to change the conversation. I had to be a parent to the case. Well, this poor dentist did what I did 25 years ago. He took a piece of flat mylar and he closed the space. And you can see that he closed the space, and he was very happy. He was amazed. He says, wow, look, I got a good contact. And he handed the mirror to the patient. This is, once again, this is the wife of the orthodontist. And the orthodontist, you know, her husband said, close the space. So the guy closed the space with bonding. He was happy. But when he handed the mirror to the patient was really mad. She was upset. And she said, I don't like it. It's ugly. It's the wrong blank. What do you think she said? This lateral incisor, it is the wrong blank. Fill in the blank. So tell me the word. Everybody tell me the word that you think she used to describe what this lateral incisor. Now, the dentist who did it was happy. He closed the space. He felt very good about that with his flat mylar. But she hated it. She said, it's the wrong blank. What word did she use, everybody?
Looks like a baby bump.
A what?
Looks like a baby bump from this angle.
A baby bum?
Yeah.
A baby bum? Like the bottom of a baby?
Yeah.
That's the first time I've heard that.
So it's to cheer you up.
It's the what? The cherub bum? Okay, other than the baby bum. No, it's the wrong blank. What did she say? It's the wrong what? Let's have our Facebook Live people comment. It's the wrong what? So we have to wait. We'll wait a minute. We want to make sure everyone feels engaged today. So we will wait for comments from Facebook Live.
Trying to connect and get the answers from the Facebook. So just hold on.
What was that, Disha?
I'm just trying to connect and get the answers from the Facebook.
Okay, that's right. I'll wait.
So most of them are saying that the shape is not right.
Right, but I want them to think what word the patient used. It is the wrong blank. It is the wrong what? What word?
I have something like guava fruit. No symmetry.
Asymmetric guava fruit.
Thanks.
Yeah, I think that's it.
Okay. So let me go ahead and say that when I ask dentists, I've shown this case quite a bit. Sometimes dentists say it's the wrong color, right? Some people will say that. And the match there is not great, but color is less of a problem to patients than shape. And it comes, and that is because of what was called negative space. And so the tooth casts a shadow or a silhouette, and that's what patients see over and over again. So one of the other problems with the shape is that they had to change the emergence profile. So let me ask everyone again. This dentist, when he did the bonding here with his flat mylar, he changed the emergence profile supragingivally. So if we want to change the shape of a tooth and close a diastema or a black triangle, we need to change the emergence profile. So I'm going to ask a question to everyone on Facebook. If we're going to change the emergence profile, do you want to change it supragingivally, equigingivally, or subgingivally? So let's ask everybody that question. Do you want to change the shape supragingivally, equigingivally, or subgingivally? So let's ask everyone. Let's ask everyone to type in an answer to that.
Subgingivally.
Okay. Is that did we allow the people to put that comment, or are you answering that?
On Facebook, some say subgingivally.
Okay. So let me ask the next. Let me ask the next question. Perfect. Subgingivally. So we have another question from Aditya Shahabadi. Hi, do we prepare the tooth before the restoration? The way we prepare the tooth is to apply disclosing solution, and then we blast with aluminum trihydroxide with the bioblaster. And that is the only preparation that we need to do additive dentistry. That's a good question. So the answer to the other question, which is we need to change the emergence profile subgingivally. So here's the next question for everybody. How do you change the emergence profile subgingivally with composite? How do you reflect the soft tissue? How are you able to change the emergence profile subgingivally with composite? How does that happen? Does everyone understand the question, Disha?
Many also say equigingivally. On Facebook, many have said equally gingivally.
Mm-hmm. So let me answer equigingivally. If you change the emergence profile equigingivally, you're either going to have an overhang or a black triangle. And so that's been the problem that happened before we had Bioclear. So if we're going to create these beautiful pink and white aesthetics, that emergence profile has to change subgingivally. And we were never able to do that before Bioclear. So what Bioclear does for us, and until you do Bioclear, you won't understand this, that the matrix is so strong that it pushes the soft tissue away from the tooth. It pushes the soft tissue away from the tooth like retraction cord, and then allows us to change emergence profile subgingivally, and then the soft tissue will remodel itself, and then we get this beautiful pink and white aesthetic. It's something that is very central to the Bioclear method, which is these beautiful pink and white aesthetics that people absolutely love. So what we're going to be doing now, Dr. Jacob PCS, what are the chances of fracture? Well, if we create a monolithic restoration that is injection overmolded, and if we have the right clearances on the incisal edge, we see very few fractures. But we have quite a few rules for injection overmolding, and one of them is that the incisal edge has to be 2 millimeters thick buccolingually. So let's go ahead and take a peek here. We're gonna go ahead and talk about this case for just a minute, and then I want to show how to actually do the peg lateral procedure, and then I think that'll answer some of your questions. So the interesting thing about this case, let's go back to the wife of the orthodontist. The dentist that did the bonding that the patient didn't like, he does not get to do her Bioclear treatment. She was mad. She went on the internet. She found me. She came in for a consultation. And so when I look at this case, we're going to be doing a lot of things. I'm going to be moving the midline over here so I can split the distance between these two teeth. I want to upright the midline. So this is the Smile Design gauge. This is one of the tools that we use for both diagnosis and then to treat the case. So I'm going to move the midline over. That will allow me to mitigate the space here. So I'll do both the centrals and the laterals. In fact, in this case, we're going to be injection overmolding about 20 teeth because she wants all her black triangles to go away. So in a case like this, by the time you finish a case like this, that's what it's going to look like. So we're going to injection overmold about 20 teeth. And the charge for Bioclear should be very similar to what you would charge for a porcelain veneer. So is it rupees in India? What is it? I forget. Is it rupees?
Yes, it's rupees.
Yes,
How many rupees for a porcelain veneer?
No, say 15,000.
Yeah, that's right.
Okay, so do the math. That's 15,000 times
$150, $160, close to.
Yeah. So how many rupees again?
15,000.
15,000. So 15,000 for
on average.
so you can do the math, but this case is that would be 15,000. That's 15,000 rupees. So that would be 300,000 rupees to do her case, I believe, for 20 teeth. Is that right?
That's what you propose. That's what you're
I
proposing.
propose. And guess what?
No. If 15,000, I would be per tooth. Not.
Yeah,
I don't think anybody would do a veneer for less than 15,000 a tooth.
Yeah.
Correct.
So what I'm saying is, this case, she's ready because she wants all her black triangles eliminated. She wants to have their teeth done with the Bioclear method. We're going to add the missing incisal edges. We're going to injection overmold 20 teeth. That's 300,000 rupee case. Here's the point. I don't get to do a $300,000 or 300,000 rupee case every day. But if you don't have the skills, if you don't understand the Bioclear method, if you don't have the right equipment, you will never, ever in your life get to do a case like this. And if you do the Bioclear method, at some point, someone will walk in your door and say, I want Bioclear. Whether it's 1 teeth or 20 teeth, it is amazing. But you have to be ready. And here's the point. The point is, the doctor that did the bonding, okay, with his flat mylar does not get to do the 300,000 rupee case because he is not a Bioclear specialist. So the exciting thing is if people want to do this, it's a journey. And someday you will have these big cases that walk in and the patients will demand the Bioclear method because that is coming to your city. We have more people watching Bioclear videos in India than anywhere else. And most of those people watching those Bioclear videos are patients. I get emails all the time from patients in India saying, where's a Bioclear specialist in my town in India? So this is something that is exploding in popularity with patients in India. And when I was in India, I saw lots of advertisement for Gucci and Rolls Royce and Mercedes. You know, there is wealth in India like everywhere else, and there is status, and people are asking for Bioclear. It is something that people want, that people see that it is a quality thing. And that's pretty exciting. So what I'm going to be doing now is we're going to be doing a peg lateral exercise. So I need to change to the microscope. Hey, Disha.
Yes, Dr. Clark.
We've had a small change. We're not doing the peg lateral today.
Okay.
Okay, so Disha, we had a little bit of a confusion. What we're going to be doing today instead is we're going to be doing black triangle and deep caries at the same time, okay?
Okay, that will be great.
Good, okay. So we're going to switch to the microscope feed, and we're going to be doing this case. And then after I finish this case, Disha, we're going to go ahead and have you go through your presentation, okay?
Okay.
All right, here we go. So if we can have people asking questions as we go along, we can answer them.
Someone asks where are the chances of fracture?
Yeah, I think I answered that. There we go. All right. So when we do a case like this, the first thing I'm going to do is think about, okay, what is next? What are the steps to appropriately treat a case like this? So what we're going to be doing is I'm going to be injection overmolding the 2 central incisors. And with Bioclear, we typically do a little bit of additive dentistry. And then once I finish the centrals, the patient's going to come back and possibly do the laterals and the canines with an aesthetic upgrade. So we'll be adding a little bit of volume onto the teeth, about 0.5 millimeter to help for blending, all right? And so let me, can I have my models over there? So let me show you a couple of problems with traditional dentistry. And so let me show the case preoperatively. Disha, can everyone see the image?
Yes, Dr. Clark, it's clear to me.
Okay,
Yes,
good.
we can.
All right, so let's take a look at some possible outcomes for this case. Now, this is not a very good outcome, okay? This was done with one of these new omnichromatic materials. It's very translucent. With the Bioclear method, we do not use translucent composites. If you take a look at this, this is a case where there was no radius bevel, there was no additive dentistry, but they just did a margin like the old days with these new omnichromatic materials. Now, if that omnichromatic material was sitting on the facial, that would be okay because it's just translucent. But over here, you just, like I said, it's not the look that we want. So we use Filtech Supreme Ultra because we like the opacity of Filtech Supreme Ultra to rejuvenate the tooth. So that is something that has 3 things that are wrong. They used the wrong composite, no radius bevel, and no additive. The next tooth that you'll see here is we did 2 things correctly. This tooth was treated, we did it in a webinar the other day. I didn't do the radius bevel. I didn't, on a deep class 3, we do have to prep the tooth with the radius bevel. And Disha, can you see that there's just a little bit of grayness there? We did the Bioclear method. We used Filtech Supreme Ultra, but we did not do the radius bevel. And you can see that there's a change in the color of the, you can see the difference between the composite and the tooth. Can you see that, Disha, or not?
Yes, Dr. Clark, I can see that.
Okay,
Very,
so that's,
very industry, yeah.
yeah, and so this is the full Bioclear method with a radius bevel, additive dentistry. We added about 0.5 millimeter of fullness with Filtech Supreme Ultra, and the blending now is perfect. And the thing is, I mean, this dentiform is crazy, crazy white. So to match this is very challenging. So that's our goal. So what we're going to be doing is, so if I were doing this case clinically, I'm thinking about how do I blend, how do I take care of all these things, and then all of the logistical steps about the Bioclear method. So the first thing that I'm going to do before the rubber dam goes on is I'll take the true contact sander between all the contacts. And that allows us to have a beautiful rubber dam if you don't take the true contact sander through, the rubber dam will tear. So here's an example that we show at the Learning Center of a perfectly punched rubber dam that helps us to keep the gingival margins perfect with Bioclear. But to get a rubber dam through the contacts, you have to take the true contact sander first. And then before the rubber dam goes on, I know that I'm going to have to optimize the contacts. The number one reason that we have a problem with Bioclear is because the matrices are not seated. And the number one reason that we don't have a seated matrix is people did not optimize the contacts. So we're not going to open the contact. We're just going to sand the contact lightly. Now I'm going to take the last in the red true contact sander. It's double-sided, and that allows me to have a contact that's just lightened. It broadens the contact and allows the matrix to slide all the way to the bottom of the sulcus. Okay. So before my rubber dam goes on, I'm now going to measure with the black triangle gauge. So I'm going to come in here. I'm going to measure from the facial with the black triangle gauge, and that is binding at the blue. And then on the lingual, it's binding between blue and green. So then I would ask the patient what their preference was. I would say, for this black triangle, you're really sort of between sizes. Is it okay for me to leave a little black triangle or not? And if I close the black triangle completely, the tooth will look a little bit more rectangular. Usually the patients say, make the black triangle go away. So with the black triangle kit, can you get me the black triangle kit, please? So with the black triangle kit, here's how the kit comes. And I'm sorry that our camera's not working today. Next time we'll have it working and we'll show you what this looks like. So with the black triangle kit, what you have are you have a small and a large tub. You have the disclosing solution, the sanders, and the gauge. Sorry, this is so blown up. So in this case, we're going to use the large matrices. And I'm going to be using a pair of the blue matrices here. Now, this is a really fun exercise to do. And we want to set up live remote hands-on classes in India like we do in the United States, where you have a chance to injection mold with these new exciting black triangle matrices that are custom built for black triangles. So I'm going to use a pair of the blue matrices, and you always have to slide them in at about a 45 degree because of the curvature. And then I'll slide another blue one in like so. So if the matrix doesn't go in place, I have to remove the matrices and do some sanding. So you'll notice that we have a nice closure of the black triangle. This is the new HD material that is as strong as stainless steel. Now you do need to grip the matrix with your hands. You can't just push on it like this because it'll bend. So you have to grip it against the tooth and seat it all the way down. Now on the distal, I'm going to be using classic Bioclear. So this is the A102. It's a very curvy matrix. This is from the original Bioclear kit, and I'm going to be using it in the HD. So I'm giving everyone to see a chance to see two different types of matrices. This is classic Bioclear. You could use this for black triangles, but the black triangle matrix is a lot easier to use. So this is for standard fillings, right? Standard restorations. I'm going to slide the matrix down. I'm fighting the matrix. So now I've got to go back in and I've got to sand the contact, because now that I have matrices here, this contact got tight. So I'm going to sand this to lighten the contact, but not open the contact. So I'm sanding here, and that's still pretty tight. Let me have the red sander one time. That's the double-sided sander, and that's should allow the matrix to come in and seat all the way apically. So I'm all set up. My matrix is all the way subgingival, and I'm ready for injection molding. So I like to try the matrices in before the rubber dam goes on to see what the relationship is with the soft tissue and the matrix. So now I would take the matrices off, put on the rubber dam, We're 2 hours today.
Right. You've got 9
It's 6:30.
minutes and then.
And then Disha's time.
Yeah.
Yeah. Okay. So Disha, I'm going to go as fast as I can here. You're gonna be more like 6:40 by time before you get started. Okay. Disha, are we all right with that?
Yes, Dr. Clark. Dr. Clark, if you could just tell them a little about the radial bevel and the prep which we have to do, because I think that's one of the missing link which, dentists here are not able to get that part. So
Yeah.
it will be great if they have that from you.
So we are now doing, Carissa is doing a video right now with the Clark Class 2 that's actually done. We can send you a link for that. So this is the burr kit from Comet, and this is the burr that we could use for the radius bevel. This is burr number 2. So what we want to do with the radius bevel is, and this is part of all of the learning center curriculum that we teach, the radius bevel needs to be about the same width as the deficient tooth structure here. So my radius bevel is going to be about that big, and that allows us to blend the restoration. So you can do this with different burrs, but this burr is specifically built for the radius bevel. And then you can also cut this, God, my 3 matrices just ran away. You can also cut this with the standard burr, but it's a little bit harder to do because this burr is convex and we have to be very active with our hands to create a convex radius bevel. So you can use the same burr, but it's a little bit more challenging. Now I'm just going to scratch all of this tooth up so I can do, so I can get the composite to stick to the dentiform tooth. Once again, I don't prep the tooth clinically. We just use disclosing and blasting. So I'm just cleaning all this. I'm just getting the glaze off of my off of my tooth. So we're going to go ahead and do the one tooth here. I'm going to injection mold that and quickly sculpt that. So now we're ready to injection mold. That's the radius bevel. And so our goal today is to briefly discuss all these things, and we can have an opportunity later to talk more about all the cavity preparations. There is a lot to talk about. I wanted everyone to get a picture of how this thing works from start to finish. I know it's a little bit frustrating because everybody wants all the answers today. I do too, but Bioclear is a journey. So that's all the time that we're going to have to talk about the radius bevel. We can talk about it maybe quickly in the wrap up. So now we're ready for injection molding. So could I have some acid etch? So we would acid etch the tooth, rinse and dry, which we're not going to show you today. And then what we do is we massage the Scotch-Bond Universal into the dentin tubules for a full 20 seconds, which is forever. People don't spend enough time doing this. So we don't use liners, we don't use gluma. We just do modern cavity preparations with selective caries retention when appropriate. That's 20 seconds. And then we're going to air thin and light cure. Go. So that's 10 seconds. Okay, moving the filter away. All right. And now we're ready for injection molding. So there's 3 phases of injection molding. Number 1 is adhesive as a surfactant. So now we're going to go ahead and get the entire complex wet. Remember, we have acid etched this previously. We just didn't show you this because it's a dentiform. So now your job is to simply get the tooth very wet with adhesive as a simple surfactant. A little more adhesive, please. Now we're going to air thin this, but not light cure. Now we're going to inject the heated flowable composite. And so I've got all these things in the heat sink heater, and that's at about 68 degrees centigrade, I believe. We're going to inject the heated Filtech Supreme Ultra Flowable at about a 45 degrees, starting at the palatal, coming out to the facial. And then I'm going to coat the contact here. And then I'll do the mesial, same thing. This is heated flowable composite, and then we coat the contact. And now I'm going to go ahead and marry the flowable composite that was injected from the facial. And we actually fill the lingual in a case like this because we're doing an aesthetic upgrade of the tooth. The last thing I'll do is to bring in my heated paste composite. We're going to push the matrices apart and start injection molding. My compule is about a 1/2 millimeter off the tooth. We're going to push the paste in like so. You'll notice that the matrix is doing a beautiful job of containing the composite. I'll use the neighboring tooth as a reference. I'm going to massage the paste like this, massage like this, and then we'll bring in and gently scoop out any excess on the gingival. We'll scoop away any excess here. Wipe, please. We'll scoop right here. And then clinically, you'll need a dry brush because you'll typically have excess that goes on the wrong side of the matrix there. And dry brush. And then I'll do one more dry brush on the lingual. Move that burr block for a minute before I impale myself again. And we look good. Let's go ahead and cure. Now I know this is a lot going on all at once. I wanted everyone just to kind of get shocked here. Disha, can move the paddle now. And just to see what's possible when someone does the Bioclear method every day, all day for 20 years. You can get very fast at the Bioclear method. Yeah, Charlie's Rockstar Polish video is done, right? So, all right, so now we're going to go ahead and take the matrices off. And it's very important to take the Explorer and reach under the contact. This is the Clark Explorer. It's super helpful. This is monolithic composite. It has about the same compressive strength as Emax Press. And let me go ahead and have the hemostat. So I'm going to zoom in right here, and I'm going to show you what this monolithic restoration looks like. Say, Disha, can you see this yellow right there? Disha, can you see that yellow right there?
Yes, Dr. Clark, I can see that.
What does everybody think that is? Let's see if your people understand what that orange is.
Is it unpolymerized resin?
Yes, that is
Polymerized resin.
That is adhesive. That is adhesive. And I haven't completely cured it up there. That adhesive started here and went all the way to the incisal edge. I want you to look at this beautiful, amazing, crazy emergence profile. So did Dr. Clark change the emergence profile subgingivally? Yes, he did. That is
Dr. Clark.
everyday stuff.
Yes, Dr. Clark, I have a question right here.
Yeah.
I'm Dr. Harsh. It's a beautiful emergence profile. Since we discussed about building an emergence profile subgingivally, so how do you isolate subgingivally because there is sulcular fluid? So how do we get a proper isolation subgingivally so that sulcular fluid does not affect the bonding procedures?
I would add to his question, do you use laser every time when you do a diastema closure?
I don't own a laser. Lasers are great, but I don't use them for this. The second question about isolation is, we give a little bit of local anesthetic that will provide some hemostasis, and the matrix provides a little bit of lateral pressure against the gums. And so we're able to, because the matrix is only there for, a few seconds before we injection mold, with the rubber dam, it is literally bone dry. It is amazing. And so a lot of doctors doing Bioclear are using a microscope, And when you do your first Bioclear case and you look under the microscope, you'll say, wow, that is dry. So it's one of the miracles of the Bioclear method. And it was something that really surprised me, how when you create that gentle lateral pressure of the matrix, that we don't get bleeding or clavicular fluid. The best way to stop bleeding is direct pressure, and that's what the matrix does. So now what I want to do is I want to finish the procedure quickly because we need to get to Disha, and then we can answer some of these questions as we go along, because I don't want to not get done here. So let me go ahead and we're going to bring in the burr. We're going to cut exactly 1 millimeter from the incisal edge. Go. And then we come along here. We're going to cut about 1.5 millimeters from the tooth because we're going to veneer over the tooth. Softflex XT disc. Now we're going to bring the Softflex XT disc. This is the 3M disc. I'm going to bring this to grade, and we start on the incisal edge, and we're going to tip that disc about 15 degrees to the palatal, because that's the typical wear pattern. Now, each case will be a little bit different, but these incisal edges are really important to the patient. And so I'm going to bring this in at about 15 degrees, like so. Then we'll bring the disc in the inverted position. I'm going to roll it like this. So in a case like this, I'll be veneering over the facial, leaving about 0.5 to 1 millimeter of composite. Slow the disc down. We're going to round our incisal embrasures. Then I like to come in and do a 45-degree bevel. Now, Disha, this is kind of new. This keeps us from violating the neutral space. I'm going to roll this in at 45 degrees here and 45 degrees on the palatal. And that's my general shape. Now, of course, I'm going to be doing other teeth later, but like I said, I wanted to show you the process for a single tooth. And now we have the magic mix. So then we'll bring in our magic mix. Now, normally I would be doing the entire quadrant. And so should I go ahead and do the?
Well, we can send Disha the link for the Rockstar.
So Disha, maybe the thing to do now, it's 6:30. Would people like to see the Rockstar polish, or should we go ahead and do your presentation now? What do you think, Disha?
Dr. Clark, I think we'll see the Rockstar polisher. That will be more beneficial for all.
So would you like to see that now?
Yes, we'll just go ahead and see that.
Okay. So the Rockstar polish is a two-step. This is the magic mix. And so we put some up here on the vestibule. There you go. Thank you, Tanya. This is what comes with the system. So we're going to go ahead and get a disposable cup, run this at about medium speed, getting fresh magic mix every few seconds. Okay, do you have a little dish ready? We're just going to make a mess. Okay, and now we're going to go to the final, which is the Rockstar polishing cup. We got to get all the magic mix off. Okay. All right, and now this is the Rockstar polishing cup. We're going to start with this dry, and then we'll with light pressure and constant movement. Okay, go ahead. And then I can go ahead and use the cup on its side to create a little bit of mamelon groove development. And now wet. Now we're going to stop and move to heavy pressure, about 3 pounds, slow movement and constant air water to cool the tooth. And that is the Rockstar polish.
This is
And that
beautiful.
can take 6 minutes from start to finish once you get good at it. Now, you won't be that fast the first time, right, Disha? But this is a learned skill.
But I feel that compared to any other polisher, I get polished very fast when I use Rockstar polisher. I think it's just a trick that, we just get the hack of it and it becomes very easy.
Very good, Disha. All right, so we want to make sure and get to all of our content. We'll answer the questions at the end. So let's go ahead and trade. Now, Disha, I'm going to let you go ahead and do the presentation. And then, like I said, we can answer questions at the wrap-up time. All right?
So, Dr. Clark, I'll just take, I won't share much. I'll just share one case. Will that be okay? So that
Sure.
we have more time for questions.
Okay, so we're going to put your presentation up now, okay?
Okay, I'll just share that now.
Now we have your presentation.
Oh,
Oh,
okay.
No, Disha, if you've got it, you put it up. Yes? Okay.
So my network is really poor, so I'll just go a little fast. Can everybody see that?
Yeah, we can see.
Yes.
We can see that.
Okay. So thank you, Dr. Clark. This is one case which I really liked, and I love treating this patient. So this was a very young boy, about 20 to 23 years of age, and he was traveling for a vacation in next 2 days. So he had a bike accident and he fractured his teeth. And he was in a lot of pain. So we did his root canal treatment, and then we decided because it was a trauma case and he had injured his lips and everything, we did not want to give him the crown. So we decided to Bioclear. So I put in short post, which was absolutely conservative without drilling. And then we did the post. And then I use these matrices, which are called as 360-degree veneer matrices. So if you see, this was the tooth I was restoring here. And do you see that I have another matrice just next to it? So that matrice is called as a shield or a shepherd matrice. So what this matrice does, it prevents this matrice to come into the space of the adjacent tooth. So that is a very important step which we often miss, and then our proportions go wrong. So this is something which I wanted to say. And then I sandblasted, put in my bonding agent. We did not cure the bonding agent. And then we did the injection molding, and that's after injection molding. And yeah, the adjacent tooth also had a bit of fracture. So we can see I have prepped the tooth, and we have like the amount of tooth which is fractured was the size of my bevel. So that's the key to know how much we have to prep. And then this was the
Disha, are you there? We are not able to hear you.
Okay, so have we lost Disha temporarily?
Yeah, I guess we lost her. Yeah.
Okay, well, what I could do is we could answer a few questions until we get Disha back on the line. What do you think?
Yeah, I think that's right. So my first question to Dr. David Clark is when you're using Bioclear technique, the first after etching, the first layer of adhesive is what we cure, and the next layer of adhesive is which we don't cure and inject the flowable along with the heated composite. Is that correct?
That is correct. And so
Okay.
the question that we ask ourselves with the Bioclear method is always this. Number one, do we have freshly cut dentin tubules anywhere near the pulp? And if we have freshly cut dentin tubules near the pulp, we're going to massage the Scotch Bond Universal adhesive into dentin tubules for a full 20 seconds, air thin, and cure. Now, if I'm doing a peg lateral, we don't have to do the separate curing of the adhesive step. We go straight to injection molding. So injection molding is 1, 2, 3. Adhesive as a surfactant, air thin but not light cure, then flowable, then paste. So the question is always, do we have freshly cut dentin tubules, which we're going to have a lot of the time. So that's when we have the step where we cure the adhesive. So does that make sense?
Yeah, that makes a lot of sense.
So the people always ask, when do I cure the adhesive? It's a really simple question. Ask yourself this: do you have freshly cut dentin tubules anywhere near the pulp? If the answer is yes, then you will need to cure the adhesive over the dentin after massaging for 20 seconds, air thin and cure, and then you injection mold. And then you repeat the adhesive as a surfactant. Okay, is Disha back with us?
yes, I'm back, but I'm sorry, where did I stop? I don't remember. I don't know.
Disha, you were on slide 33.
Okay, so that was the prep size, and so the x equals to y. The x is the amount of tooth structure which I have kind of lost. So then we did this. This was the picture after the finishing, but I've not completed the polishing yet. So if you see, I've given in a bit of specular highlights and a bit of grooves. So that gives it a bit of natural structure, but we do not place, grooves which will retain plaque. So we always have to take care that it's a non-retentive, plaque retentive area. And this was the result which I got after doing my Rockstar polishing. And I just love it. I love the Rockstar polishing, and some more views. And this is the symmetry. This is the smile gauge which we get from the Bioclear Center, and it's really helpful to just orient ourselves whether we are going right or wrong. We can use it a couple of times while doing our cases. Yes, so we had many questions that why does Bioclear not fracture? What is it? So if you see that I have kept my incisal edge a little thicker. Sometimes patient initially will be, they'll keep poking their tongue there, and but then eventually it just settles for the patient. And then I have added this more on a labial side, so it does not interfere with my occlusion. So that is something which gives it the strength, and that is the palatal finish which we got. And that's the Rockstar polishing. And this was the result, the final result. And this boy doesn't want now to go into crowns. He's like, I'm fine with them. I love this. And I don't want you to change them into crowns. So yes, and then I did a 6 month recall. I didn't have, he just dropped in and I was not prepared for photography, but I made him take a photograph under microscope and yes. So you can see in this picture, the polish is so well even after 6 months. I didn't do anything for him. I just didn't do anything. I just sent him back. So I think that's the power of the Bioclear. And very quickly, I'll just show you another case, which I feel is very nice. This was a gentleman about 50 years of age, and he had this he had a very poor periodontal health. He was highly diabetic, and he came to me 1 year back with a very mobile 1-1. So we had done an endodontic treatment at that time and initiated a treatment, and the tooth has become non-mobile. But he came back because his son was getting married just next week. But I would not dare to give a crown to him at this condition because I was not sure about his periodontal health. So we completed his root canal, we did the blasting, and that's how I could not get the proper retraction. So I had to split them in this case. And I think my network is again going to go. So I'm going to go rush. So I used 101 matrice over here. And the only thing different that I did here was I did inject a bit of pink color gingival composite, just to, give it a better look. And that was his smile later. And that was the result after, say, I think 1 day or 2 days. So that was the result. So Dr. Clark, I would stop at here and I would want to go ahead with your presentation and the questions which everybody has.
Wow, those were, Disha, I really enjoyed looking at your cases. I'm really proud of all of your learning, and you've done a nice job of really sharing that with everyone. I want everyone to stop and think about this for a minute. You are all experiencing a major shift in the dental world. Implants were a big change, and rotary files were a big change. Injection molding with the Bioclear method is a big change. And it is disruptive. It is uncomfortable for some people, but it is something that scientifically is very solid. And the people at 3M have been doing extensive research on the Bioclear method. And now we have partnered with 3M and are teaching the Bioclear method globally. We have been working with the folks in India for, I think, about 10 years now. It's been a while, and we would like to, really invite everyone to grow together. We have some folks who have been to the Learning Center, such as Disha, and these people are experts in the Bioclear method. And so, I am just one person. And so it's important that we use our new experts like Disha to help share and to grow the Bioclear method. Bioclear method is a very disciplined approach. It is the same. So when you hear someone who has been to the Learning Center, who has gone through, Disha's gone through master track training, you'll hear the same lexicon, the same words like the shield matrix or delayed wedging, or injection molding, and these are terms that we all share and that allow us to grow together. So that I think it's an exciting moment, and I want everyone to kind of celebrate a little bit, even though the world is in a weird place right now with COVID. But that's going to pass, and I think it's exciting that we all get to move forward with this new movement of the Bioclear method together. So I just wanted to take a minute and kind of talk about our Bioclear family. What I'd like to do now is take some questions from the panelists. We have about 8 more minutes that we can talk. This is a question that's what I like to call an older question. So I got a question from Dr. Katavkar. Dr. Katavkar, would you be concerned about curing shrinkage while injection molding with all of this composite? And the answer to that is that it's not that simple. Polymerization shrinkage is something that all composites do. If you layer it, it doesn't change the shrinkage dynamic. So one of the fallacies, one of the unfortunate old conversations is that layering would mitigate polymerization shrinkage stress. Layering does not help us. So what we're doing with injection molding, whether it's in the anterior or if we're using a bulk fill in the posterior, is that with Clark Class 2 and with all of these anterior restorations, our C factor is less than 1. In other words, when you put a filling in a hole, it has bad C factor. There's a lot of cavity walls, and then the composite shrinks away. Now, in contrast, let's imagine that I was in India right now and I was with Disha and I gave her a big hug, okay? So imagine Disha standing there and she's not very big, okay? I'm bigger than her. So I'm going to stand over her and give her a big bear hug, right? I would be the composite. I would be wrapping around Disha. There's more of me than there is of Disha. And as the composite shrinks, it shrinks into compression and simply puts what we call shrink wrapping. Or just like when you make a screwdriver, you inject the plastic around the metal blade of the screwdriver, it shrink wraps the tooth. So polymerization shrinkage in the Bioclear method can actually be favorable. And so it all depends on C factor. And because Bioclear goes around the tooth and not really in the tooth, those old conversations can disappear. So Disha, did I explain that question that Dr. Katavkar asked about the shrinkage problem? Because we get that at every lecture.
Yes, we do get that. And even when I go, I've been asked a couple of times, how do we prevent that shrinkage? Because we are doing a complete wrap for the composite for the tooth. I think it's not a problem. In Bioclear, almost 80% of the tooth is covered in composite. So I think that's the best explanation Dr. Clark can give.
Yeah, and once again, it all gets to C factor. It all gets to C factor. And
maybe
remember,
we can discuss a little about C factor next seminar. If we have the time, we can discuss about the C factor.
Yes. So,
so Dr. Clark, I have few questions. Can I, from the Facebook, so can I ask them if it's okay?
yeah, go ahead.
Yes. So do we use floss ties in the Bioclear method? So this question is by Dr. Tanushree.
Yeah, floss ties are okay. I don't use them anymore. One thing that we teach at the Learning Center is what's called a root overlay, where we put a little button on the facial and then that holds the rubber dam back. One of my goals, hopefully, for you, Disha, is that you can continue to teach some of these advanced principles with Bioclear. There are many chapters, and so there is a way to really take some of the advantages of using those floss ties that people like to do with rubber dams and really taking it to another level with what's called the root overlay. So these are different chapters that Disha, that you could potentially share with your folks and in your group.
Yes, I'll try to share that. I'll try to share the root overlay details.
Yeah, and that is the same principle as the floss ties, because we love rubber dams, and I'm excited that whoever asked that question, I'm excited that you're using a rubber dam. Not everybody uses a rubber dam, and I think that that it's the mark of a great Bioclear dentist to use a rubber dam. And you know, here's the other thing is that with COVID, putting a rubber dam on is going to decrease the amount of aerosol virus issues potentially. So that's something else to think about. We have a question from Sanket. Can this technique be used with palate matrices in the posterior? So the question is, what about
Dr. Clark, the next question which we have is.
Oh, hang on a minute, Disha. I was just answering this question that was on the Zoom panel, was from Sanket. The question is,
Okay.
yeah. So what we're going to be doing to answer Sanket, we're going to be talking about injection molding of posteriors next week, and this will be really exciting. One of the problems with using a palate or metal matrix is that you don't have the ability to do what's called 3-point curing with a metal matrix. So we're going to be showing you injection molding next week with these new BioFit posterior matrices that allow complete light penetration. So the answer is, yeah, we can do injection molding of class 2s, and that's what we're going to cover next week. So I think I think that you're really going to enjoy. I love doing injection molded class 2s. I love it. Okay, go ahead, Disha.
So, Dr. Clark, there's a question by Dr. Tanupriya. She's our core Endo Haveli member. When we acid etch and rinse dry with these matrices in place, are there any chances of moisture retaining inside them?
One of the things that people realize is that one of the best ways to get isolation and good hemostasis and good control of fluids are simple, old-fashioned restorative things. So the first thing is, if you give a little bit of epinephrine in the area, if you give a little bit of anesthetic, that's going to cause some vasoconstriction, and you'll have less curvicular fluids or circular fluids. So a little bit of epinephrine is helpful. When you place a rubber dam and then you place the matrix with the rubber dam, it creates enough lateral pressure that you get a beautiful seal. And I've done over 1,000 Bioclear restorations. I do everything at 16 and 24 power. There is no curvicular fluid in these cases. I mean, the only time I've ever seen curvicular fluid is when patients had uncontrolled periodontal disease and we have oozing of soft tissue in the case. And so if the patient has completely uncontrolled periodontal disease, we shouldn't be doing Bioclear. I mean, we can do something temporary. So that was the only time I ever saw any curvicular fluid. So it is amazing how we can manage this with simple restorative techniques using magnification, rubber dams, a little bit of lidocaine, and the matrix puts enough pressure in there. It's bone dry, and I mean dry. Remember, it doesn't have to be dry for 20 minutes. It has to be dry for 20 seconds. Once we're injection molded, we're good. But this is a great question that people, the doctor who asked that question will be able to answer it when they use the Bioclear method and use a microscope. They'll see that it's dry. Remember, I showed a 10-year outcome that looks perfect. We have 20-year outcomes on these things now.
So the next question, shall I go to the next question?
Yep, we have one more question and we got to wrap it up.
Okay, so we have, why don't we cure the first layer of adhesive on the enamel, but we cure the dentine? So typically in Bioclear, we do not cure the adhesive on the enamel. We just directly inject. So that question is by Dr. Varsha Rao. So why don't we cure the first layer of the adhesive on enamel, but we cure the dentine?
And that is a very good question. We're going to end up with that because that's one of the most important questions that we get. That's a good one. Dentin bonding and enamel bonding are two different animals. They're completely different. When we bond porcelain veneers to enamel, just enamel, we don't cure the adhesive. So what we understand with dentin is a funny animal. With dentin, we don't want any competing factors when we cure the adhesive because dentin bonding is a lot less predictable than enamel. So with dentin, we have to cure the adhesive independently and not disturb it and not have any competing factors while it's polymerizing over the dentin tubules. because we want to eliminate sensitivity, and dentin bonding is not great. It's just okay. And we need to help it as best we can. So once we take care of the dentin, then the adhesive is put on the enamel as a simple wetting agent, just like a porcelain veneer. So remember this, dentin and enamel are unrelated. Dentin and enamel are unrelated, and their adhesion is unrelated. You can't think of them in the same way. And so I hope that that is a good start. I know everybody, I've been to India enough, I have enough friends from India. I know that you folks are so committed, you are so passionate about your dentistry. I commend all of you. I've never seen more passion and more hard workers than all of my friends in India. The problem is everybody wants to learn everything today, Disha. That is not.
It takes a lot of time. Because the syllabus is so big, so
Yeah.
vast that
Yeah.
we need to do about 10 sessions to learn of everything.
You know what? All of you, if you're committed to Bioclear, you're going to be learning about this for the next 20 years. You're going to be getting better, like me, hopefully. I'm still getting better 20 years later. I'm still learning. So we're advancing this together as a wonderful community and wonderful family. So I just want to let everybody know, I know you'd like to have all the answers today and do everything today in your clinic. Let's just get started and continue with successes. And there's so many conversations that we will have down the road together. So I want everyone to be patient. All right.
So we'll call it a wrap, Dr. Clark, today.
Yep. Yes.
So Dr. Clark, I would really like to thank you for taking this time out, specifically knowing that, we are in altogether different time zone. You've been awake from 4 a.m., I'm sure, to give us this presentation, which was excellent. And I'm sure these techniques will help us in our day-to-day practices. I would really like to thank Carissa and Tanya, who's been extending all their organization help from past 5 to 6 days to make this webinar a success. I would also like to thank all the panelists for their participation. And I would also like to thank all the team members from Endo Haveli, Dr. Rahul, Dr. Sashank, Dr. Wazim, Dr. Nitin, who's been working very hard to make this a very approachable to everybody on Facebook. Thank you so much, Dr. Clark, once again. It was a lovely session, and honestly, I again learned many things.
Great. And we will see everyone next week. And
yes. And so I'll just announce it, Dr. Clark. Will that be okay?
yes, please.
So guys, we will have another session next week on 27th of May. But we have a little slight change in the time. It will start at 6:30 IST, that is Indian Standard Time. And the topic would be Bioclear for the posterior solutions, where we'll be discussing class 2. So Dr. Clark, if you can just give us a little more brief about what we would do next, that would be great.
So next week, we will talk briefly about the Clark Class 2, which is a completely different cavity preparation. But the interesting thing about injection molding the Class 2 is it is actually somewhat similar to doing a black triangle procedure. And I think that when people come to the Learning Center, we think that anterior and posterior composites are completely different. And by the time that people finish, like with Disha, she will tell you that when she injection molds a black triangle, there are a lot of similarities to injection molding a Class 2. They're just teeth, enamel and dentin, that have certain forces. So one of the beauties of the Bioclear method is once you understand it, of the simplicity and the consistency, as a clinician, I don't want to be confused. I don't want to have mistakes because I don't understand the principles or the steps. So the beautiful thing over the years is we now have a recipe, and we'll share those recipes with everyone, whether it's a black triangle or a Class 2. So I look forward to the Class 2 next week.
Great. That would be nice, Dr. Clark. So we'll see you again next week at 6:30. I think that would be 6 a.m. for you.
Yep. Sounds good.
Okay.
Thank you so much, Disha. And Disha, those
Thank
Disha,
you so much, Dr. Clark. And thank you, Teresa. And thank you so much. Yes, Dr. Clark?
oh, and beautiful cases. I loved your cases. I love the bicycle case.
Thank you. Yeah, thank you so much, Dr. Clark.
Okay.
Thank you so much.
All right. Goodbye, everyone.
Bye-bye.
Bye. Thank you.
Thank you. Thank you.
Bye. Thank you, everyone. Thank you so much for coming in.
Thank you, Disha. It was wonderful.